The threat ahead as the nation's healthcare system strains under the threat of RSV, COVID, and flu, and what could be in store as Americans head home from family gatherings. ABC's Elizabeth Schulze has more. Good morning to you, Elizabeth.
Eva, good morning. Here at Children's National Hospital, doctors tell us they've been operating at capacity for weeks. And now with flu cases on the rise, they warn that we are not out of the woods yet.
This morning, hospitals and urgent care centers are bracing for a post-Thanksgiving triple-demic threat of COVID, RSV, and the flu.
I don't see how there won't be another big spike. We've opened ICU beds, we've opened floor beds, we've changed the way our emergency department works. We've got a tent up outside for our emergency room.
With many children's emergency rooms packed and wait times stretching hours, some urgent care centers are overflowing with pediatric patients.
Our book ahead slots absolutely fill up the day before, so we are seeing the surge.
Health experts say decreased immunity may be one reason for this season's early and severe spike of child respiratory virus infections. Hospitals already overwhelmed with RSV patients now say flu cases are rising fast. The CDC reports half of U.S. states are experiencing high or very high flu-like activity.
Child after child, we're doing the swab, we're getting the test, and it's coming back positive for flu.
New concerns this morning that common flu medications like Tamiflu are in high demand.
We are definitely seeing shortages in some areas of supplies of common antibiotics like amoxicillin, which is the first-line medication for things like otitis media or ear infections, as well as Tamiflu and some other medicines as well.
Johnson & Johnson, which makes brand name children's Tylenol, says there's been high demand, but we're not experiencing an overall shortage.
Now, there are often alternatives for medication, so be sure to talk to your doctor or your pharmacist if you find that yours is in short supply. Doctors also say that it's still not too late to get your COVID or flu vaccine for you and your kids if you haven't already. Janae.
A lot to keep in mind. Elizabeth, thank you so much. And let's bring in ABC News contributor Dr. Alok Patel. Dr. Patel, thanks for being with us. As you just heard Elizabeth there at a children's hospital in D.C. that's been at capacity for weeks. That's the case around much of the country between RSV, flu, and COVID. Are we going to see that post-holiday surge that we've seen so many times before?
Well, Janae, that is what hospital systems are bracing for, is more cases and inevitably, unfortunately, possibly more hospitalizations. We have no shortage of gatherings right now, a lot of virus circulating in communities, some of the busiest travel days in the last few years, and all mitigations have been lifted. So people need to be on the lookout. There could be a lot more sickness around the corner.
All right. And with Thanksgiving behind us, so many more holidays ahead of us, what kind of precautions should we be taking right now?
Well, you know what I'm going to say is people out there need to make sure they've gotten their flu shot if they haven't already, and make sure that they're up to date on their COVID shots, including the new booster. And keep in mind, it takes about 2 weeks to build up that full protection. So you want to plan accordingly with the next set of traveling. And then also on top of that, testing, wearing a mask if you're symptomatic, ventilation, all of that is still extremely important. And Janae, we need to normalize and praise staying home if you have any cold and flu symptoms. We hosted a Thanksgiving, a Friendsgiving, and the winners were the couple who stayed home because they were sick. That is what we all need to be doing.
Important to keep in mind. And when it comes to staying home, we're talking about hospitals that are under such strain. You said that we're likely to see more hospitalizations. How do you decide when it's time to take yourself, your child, someone else to an emergency room where there could be more sick people?
I am so glad you asked that, because right now emergency rooms are overrun and people are waiting hours. I've even heard of days to be seen. Now, an emergency room is for, as the name implies, emergencies. And when it comes to cold respiratory viruses, that is going to come in the form of respiratory distress. In other words, troubled breathing. Any signs of somebody who's breathing quickly or using extra muscles to move air or gasping for their breath is an emergency and should be seen by a medical provider immediately. Anything else? You might want to chat with your outpatient provider or go to a clinic and save yourself some time and a lot of worry.
Okay, so the big takeaway there, trouble breathing, that is absolutely an emergency. And as we're heading into the winter, again with flu, RSV, and COVID, what's your biggest concern right now?
My biggest concern is that we're going to see more of the same, and the same is not good, because we have overrun children's hospitals, 9 times the amount of hospitalized adults from RSV in comparison to the last few years, and one of the worst influenza seasons we've seen in the past 10 years. And this is all on top of an already strained healthcare system. And we can't normalize what's happening with COVID-19 either and say that it's okay to have 2,500 dead Americans a week. But a lot of this is in our hand. Prevention is the #1 goal that we should all be focusing on as we head into a hopefully happy, healthy, and less sick holiday season in comparison to the last 2 years. So it's on us. Everyone stay empowered.
We may not hear those numbers often, but 2,500 Americans still a week. Dr. Patel, thank you so much for being with us this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.